You know, people from diverse backgrounds are finding it really difficult to fit in the mainstream. I think it's one big challenging area, and I think the issue around it is stigma. Is the huge thing. How to get that or how to reduce or minimize that is still something that needs to be worked out. But I think if we have more people representing communities, that can be addressed, and people might find their way, talking about mental health issues openly.
They feel ashamed for the stigma to talk about, and I think we should really wipe that stigma, because after all, it's another sickness of the body.
I think the area of suicide prevention is one area that hasn't been considered as serious, or has not given much attention Australia-wide. And I think it's one opportunity that MHiMA has as an organisation starting out now with this strategy plan, its working plan, to be able to address this. And health promotion is one area that I think MHiMA can also look into. I think the multicultural ethnic communities wait for mental illness to reach crisis point before they get treatment.
I believe it starts from young age, from adolescent, and if they got the right touch from the right people, probably they will prevent really different stage of their illness.
For women, it's particularly childcare issues. They're often under-resourced and left on their own and rather isolated. Newly arrived communities don't necessarily have good networks to support them, so they don't have anyone to call on, or they don't know which services exist. And they've often got a burden of maintaining a home and looking after children without much support at all, which is a very fraught situation.
There are different carers. There are strong carers, and there are other carers from different nationalities that they should be educated, because they have no idea from medical respect how really to look after the consumer.
Most of them are challenging areas that we get confronted with in our everyday work.
Those communities need encouragement to engage with the issues involved in mental health, so that they're not so stigmatised and avoided, so that people can start discussing them and addressing them and feeling comfortable with them rather than denying them, so that some positive approaches can be done to address issues in either families that are affected by it or carers who look after people affected by mental health issues.
Well, some of the takeouts that were set today in Victoria was the communication factor. I think the communication is an important element.
They need to know about the services, so it would be part of the information that's given as new settlers, but it also needs to be reiterated, because often new settlers are so overwhelmed by the newness, they just don't take in the information. So it needs to be given in multiple forms, orally, visually, even cartoons, and by their own community members in their own language.
MHiMA should try and get people from that community, the consumer and carer, ethnic communities that have potential in advocating for better services.
I thought a very good idea that came out of today is the kind of local champion or local hero, people who can speak up from that community and say, this has affected me, or this has affected members of my family, and this is what I did about it, and you too can seek help without fear of being labelled, so that they've got a role model. After today, I would like to see consultation with the grassroots level, with the people who are affected by the policies that will be put in place. So engagement with newly arrived communities and consultation with them so they can speak for themselves, because otherwise policies that are imposed, I think the past has shown us that they don't necessarily work the best.
But I'd like to see the MHiMA take the national lead in looking at the multicultural mental health agenda in the area of consumer and carer. I think training is a very important element that they should provide to the potential consumer and carer advocates that are going to be addressing the multicultural at a national level.
People that we've been here to work together, and then we get the feedback to the other communities.
And I congratulate for the consultation today in Victoria, and I'm happy that a lot was said today, and I'm sure a lot will be said in other states as well.
I don't know what agencies can do to sustain themselves and spread the word more to the communities out there, and work closely with the communities.
It is a challenge, but it is a worthwhile challenge.